let more people join in. Yeah, so we have Dr. Devesh with us finally. Thank you,
Hello.
Doctor. Thanks for joining in.
Hello, welcome all. How are you?
Welcome, everybody. So, just to give you a bit of introduction of who he is as a person and what he does. So, Dr. Devesh is a managing director at Medical Care Hospital and Center at Lucknow, and he's a physician consultant, he's a diabetologist, he's an intensivist, he's a specialist in critical care, and he has done a lot of good work during COVID. He is still doing a lot of, he's bringing a lot of change in the medical, domain, and we are so glad to have you here, Doctor.
Thank you so much.
So let's start with our thing, which is diabetes. So ये महीना November is known for diabetes month. तो इतना I just really want to ask you that ये इसकी जरूरत इतनी क्यों पड़ गई कि हमें एक entire month we need to allocate 30 days for spreading awareness regarding this disease.
See, so I want to. Is one of the most common illnesses which is prevalent in our population around the globe, and India per se has the most number of diabetic population because yes, we have 140 crore people living in our country, but we need to educate those people what are the complications, what diabetes symptoms are. So this was an initiative by the World Diabetic Federation, that is the International Diabetic Federation, along with WHO, which was started way back in 1991. So they wanted to educate the people that yes, diabetes is prevalent, yes, it is a silent killer. So to educate the people, so this initiative was taken to create awareness amongst the population.
Very great. So we just got a little bit introduction on what this month is, who created this, and the numbers are quite kind of disheartening that diabetes is still increasing, and that's one of the reasons we need to talk about it. We still need to aware people about it. So just we just passed, it was 14th of November, it was Diabetes Day. I just want to have a little bit conversation on what this day looked like and what was the theme of this day, and what's the way forward and everything regarding Diabetes Day in general.
Diabetes Day was chosen on 14th November each year by the International Diabetes Federation, keeping in mind that it was the birth anniversary of Frederick Banting. He was one of the inventors of insulin. So his birth date was 14th anniversary, hence 14th November. Hence 14th November was chosen as the World Diabetes Day. So it was just to create awareness amongst the people, and this year's theme was education to protect the future. So it was themed at that we need to educate the current population that how we can prevent the complications of diabetes in the future, how we can prevent its occurrence.
So we this day it looked like how we can stop it, but before stopping it, there's a lot of kind of which diabetes is it, and there are so many types of diabetes. So I just want to I want you to give a little bit of generic the easiest way where everybody can understand how many type of diabetes are there, and kind of a little classification sort.
Absolutely. If you go into the classification is quite enormous. But keeping in mind for the generic population, where we can simplify it, we can just classify it in three types. That is the type 1 diabetes, where the patient is of young age population and the insulin in the body is reduced and we need to supplement from the outside. Second is the type 2 diabetes, where where the drugs can be used as a treatment formula. Third is the pregnant population, that is the gestational diabetes that is prevalent in the pregnant females. These are the three basic classifications of diabetes. We do not need to go into the specific details of MODY or LADA, but type 1, type 2, and gestational diabetes. These are the three main components which we need to focus on. So, as I said, type 1, it is usually prevalent in the young age group where, see, insulin is a hormone which is produced by the pancreas, which is one of the organs in the body that helps to regulate the blood glucose levels in the body. So once insulin production is less, we need to supplement from the outside. So this is the type 1 diabetes. The type 2, where insulin is being produced by the pancreas, but the insulin is not working at the site. So drugs can be used to make sure that the insulin is working at the site, or we try to produce more insulin from the pancreas. Third is the gestational diabetes, that is the diabetes prevalent in the pregnant females. We need to focus that they have a good control, because yes, if the mother is having hyperglycemia, the opposite will happen in the fetus. The fetus will land into hypoglycemia. So these are the basic three classifications of diabetes which we see in our day-to-day practices.
Just out of curiosity, which type of diabetes Nick Jonas has? Because, we generally
celebrities who are having diabetes from the young age, they have type 1 diabetes. Type 1 diabetes, as I said, it's more of an autoimmune disorder where the pancreas are unable to produce the insulin in the body. So we need to replace them from the outside.
So is there anything like, is one more dangerous than two? Or, of course, I understand gestational is a different case wherein, you can transfer it to somebody else and the entire, it's a big deal. But what I'm trying to, figure out is one more dangerous than two, or two more dangerous? Is it something like that?
It's not something like that. See, type 1, it is not hereditary. No, it is not per se that if the parents or the grandparents is having type 1 diabetes can be transferred. But yes, if the parent or the grandparents are having type 2 diabetes, it can be passed on into the future generations or the future population. Gestational diabetes per se is the prevalent in the pregnant females.
I'm too curious to know about the treatment and the kind of, things we should avoid to not make this happen. But, first things first, I would like to, like our audience to know about, where the risk is more, which age group is involved, or what the symptoms look like. Like this is a lot to explain in short. So we'll go one by one. So, which age group is majorly, the target group, or, where you should put a break and, you should start things in a right way, or you should change things.
The symptoms prevalent are the same in type 1 or type 2 or gestation. These are all related to the hyperglycemia, that the blood sugars are above the normal levels in the body. So hyperglycemia causes the symptoms, and the symptoms are similar in all the three types. These include where the patient is having increased thirst, there is an increased frequency of micturition, there is weight loss, tiredness, there is always a feeling of hunger. So these are the per se basic features of hyperglycemia. The age group involved, yes, the type 1 diabetes is usually present in the younger age group, prevalent from 15 to 25 years. Type 2, yes, it's prevalent from the 25 to above age groups, even till the 80 years. Gestational diabetes is prevalent in the pregnant age women. But the symptoms are similar in all the three types of diabetes, and that is related to the hyperglycemia rather than to the age group.
Am I perfectly audible? So yeah, we took it. There's a lot of hunger, there's a lot of weight loss, and there's a lot of tiredness, you feel exhaustive. Did I miss anything important? I'm taking notes.
Increased frequency of micturition.
So let's now focus on the type of modifications we as youth, or maybe we as community can make it on a day-to-day basis, wherein you're not straight away to the medication part, but you're still wanting to do something better. So I would like you to give us this regular day-to-day some advice that we need to follow for
As
curing
you
or maybe.
rightly said in the starting, that India is the diabetes capital of the world. Why so? Because 70 million people, that is 7 crore people in India per se, is suffering from diabetes currently. And those numbers are expected to escalate exponentially by the year 2030 or 2035. So, and also the worrisome part is the population who have pre-diabetes, that who are bound to develop diabetes in the near future. That amounts around 20 crore. So these patients need to target their blood glucose levels and keep in mind that if they have a family history, they are prone to develop diabetes in the future. So they need to incorporate some lifestyle modifications so that they do not develop diabetes, or they can keep the blood sugar levels in the control range. First of all, keep your diet in control. The diet modifications: keep a calorie restricted diet. Second, have a regular exercise regime that you are incorporating to burn calories. Third, take more plant-based foods, specifically the green leafy vegetables. Avoid complex carbohydrates. Fifth, you need to have a balanced diet where even the oily foods, less salt intake is to be incorporated. So these 5 things have to be incorporated in our day-to-day lives to prevent diabetes, or
Now,
the
yeah, I'm
progression
Sunday.
from pre-diabetes to diabetes.
Okay, from pre-diabetes to diabetes.
Diabetes. You need to lose the extra fat, keep your BMI in control, specifically the population who have family history of diabetes.
Got it. Thank you. That was a lot to, like, for example, the age we are into, the diet seems to be a very easy thing, but then, you're kind of like junk, and then and talking this on a Sunday is a lot
Absolutely.
of toll. But then hard things, you take time. This is not an easy thing, and diabetes is a chronic disease. It is a dangerous disease. Some even refer it to as a termite to the body, wherein it is, correct me if I'm wrong. I've heard this, that it's like a termite to the body. It slowly and steadily, it is going to affect you in a way that, you won't know it also, but then it's damaging everything inside.
No, you are absolutely right, because people tend to ignore what are the complications associated with diabetes, because they are just focused upon the glucose levels. But we as clinicians need to know what are the complications which are happening inside the patient's body because of the raised glucose levels. So we are not concerned with per se what are the glucose levels, but we are concerned with what are the complications which have already happened, and if they have happened, how to stop their progression to the, which can cause the patient a lifetime morbidity. So these are a few things which the clinicians need to keep in mind, that if the patient has already have a complications related to diabetes, we need to stop the progression of the complications.
So, I just want, I just really want to understand out of this that it's not completely curable, right? It's a cure. Once we are into the zone, we are into the gang with nobody's taking us out. The only thing is to stop the progression, and the only way to do is through medication, right? Lifestyle changes and
No,
all.
no. That is the myth which is prevalent in the society. Once we try to cure diabetes, we classify it into 3 parts. That is 33% to each of the part. First is the diet control. Next 33% is the physical changes or the physical activity which we have to incorporate. And the last 33% is the medication, which includes both oral and insulin. So if the patient is willing to imply changes in the lifestyle modification that includes diet and physical activity, then that 66% is the major bulk of treating diabetes, which the patient can do it herself or himself. Rest 33% is to be taken care by the consultant.
So the classification seems like diet, consultant, and the physical changes. Did I miss this here?
Diet, physical changes, and the consultation.
Consultation. Got it. So moving further, I want to understand the different category of drug options we have, the different type of insulin options we have in the market right now, what's in the development phase, and the kind of availability in the healthcare sector as of now, and how we are moving forward.
See, for the treatment options which are available, that depends on the type 1 or type 2 diabetes or the gestational diabetes. For the type 1 diabetes, we have just 3 drugs, that is insulin, that is the main category of drugs, that is the injectable drugs which we are using in type 1 diabetes, along with metformin and the SGLT2 inhibitors. I'm not going into the details, but this is one of the drugs which causes excretion of glucose via the kidneys. In the type 2 diabetes, we have a lot of number of drugs targeting different aspects of diabetes or the glucose action. So if these all fail, or 4 or more drugs are being required in a patient to control blood sugars, then we need to incorporate insulin. So that was for the type 2 diabetes, where there is insulin is present in the body, either it's in the lower amount or the insulin is not acting per se. So that is the type 2 diabetes, where we need to incorporate more and more drugs, and if 4 or more drugs fail, then we try to incorporate insulin therapy. For the gestational diabetes, where we have the pregnant females, where we need to have very strict controls of the blood sugar levels, where these population need insulin therapy and metformin. These are the only 2 therapies which are available for the gestational diabetes or the pregnant females.
Okay, that was really insightful. Now I would like to understand, like, what I've planned on the list is, I want to understand that how has been the progress made in the industry, like what were the treatment options available yesterday, how we have moved forward, and how we are planning to move forward. Like I just want to understand the success maybe path, or maybe what was not achievable yesterday, how we are we are planning to move forward with that, because medical science is very dynamic, it's very evolving. जो कल नहीं हो सकता था वो आज हो सकता है, and it's if the research is strong, the technology is strong. So I just want to understand the treatment path, the success path of diabetes as as a disease, and that's it.
Absolutely. That paying tribute to Dr. Banting, who discovered insulin way back in 1925. So a lot have changed in the management of diabetes per se, specifically in the type 2 diabetes, where we have incorporated more and more drugs. Like initially we had just 2 or 3 classifications of drugs which we were using in the patients, but in the last 2 decades, specifically in the last 1 decade per se, there are 4 new categories of drugs which are available for the management of diabetes, and this has led to delay in the usage of insulin therapy. The patients are not exposed to the injectables, to injectable therapies. उनको injections नहीं लगाने पड़ते. They have a motivation. Yes, they can be controlled with drug therapy itself. So for the type 2 population, there are 8 categories of drugs which are now available in the last 2 decades. Initially, there were just 3. Now it's up to 8 category of drugs.
So that's a remarkable progress. So from 3 to 8. So we have come a very long way as an as an industry, as a whole industry. and अभी हमको इंजेक्शन नहीं लगाना पड़ता जो जैसे they show in the previous movies and everything, and it's terrible the way they show it. Moving forward, okay, let's talk about how do we get to diagnose diabetes. Like, of course I get the symptoms, right? But then there has to be a procedure. If I get the symptoms, right, I come to you and I maybe consult a physician nearby me. How is the process looking like? Like, what tests will go on? What is the process wherein I get to know if I am a diabetic or if I'm not a diabetic?
If the
Hello, am I
fasting
being
blood
audible?
glucose levels, yeah. So if the fasting blood glucose levels are above 126, or if the random blood glucose levels are more than 200 on two different occasions, or the HbA1c, that is one of the tests which helps us determine the average baseline blood glucose levels over the past 3 months. It's more than 6.5. So this gives us an indication that yes, the patient may be of having symptoms correlated with the diabetes. So 126 fasting, random 200 or more, or an HbA1c of more than 6.5.
Got it. So that's the benchmark. We cannot go if it's above this, it's a diabetic. If it's below this, it's if it's this number, it's normal.
If it's below it, you may be suffering from pre-diabetes.
Okay, if it's below it, it's pre-diabetes. So it
Maybe
means
pre-diabetes, and you
there's still a lot of journey we need to follow, and then we can cure it because it's still not diabetes, right?
No, still not diabetes, but you can keep it in check with regular consultation and having a good diet and physical activity.
Yeah, so that's my call. Good, regular consultation and good diet. So that's it for today's session, guys. We talked a lot about diabetes. We talked about what not to do, what not to eat, what to eat, what types of diabetes, where the treatments, what are the treatment options available, how the industry has changed, how many categories of drugs we get in the market these days. And so we talked all the basics about diabetes. I really hope you enjoyed this diabetes session with Dr. Devesh Rajani. And I really thank you, doctor, for coming here, accepting this invite. And that's
so
it, guys. You need to exercise. You need to keep your diet in check. You need to, so I'm again missing. You need to keep your diet in check. You need to, focus on your physical activity and regularly visit your doctor and live a healthy life. So that's it.
Absolutely.
Thank you, guys. Thank you, doctor. Good night, everybody. I wish you all a very जितना समय बचा है a happy weekend, and कल जल्दी से काम पे सब अपने अपने से लग जाइए. Thank you, doctor.
Bye bye.
Thank you, everybody.